is making tourists pay to use NHS racist? No. No, it isn't. Why are you bringing race into this? But from the Sunday Times, making tourists pay to use NHS is racist, say doctors, particularly from the BMA, the British Medical Association. Doctors have voted overwhelmingly to stop charging foreign patients for NHS care, claiming that doing so is fundamentally racist. How? How is it racist? They could be white people. So is that still racist? Because it's racist against white people. I'm glad we finally agree with each other. Then it's also racist against black people. And yellow people. Is that not okay? Because now it's Asians, but it's Far East Asians and not just Middle Eastern Asians, even though they're all Asians. No? Okay, right. So, up to 500 delegates at the British Medical Association's BMA annual conference in Belfast backed a motion that said that asking overseas visitors to pay made medical staff complicit in racism. That's not the job. It's not what they should be doing. We are doctors, not bodyguards, Omar Risk said during the debate. Yes, I agree. You do the doctor stuff. That's it. So there's a law saying that these people are not meant for you to treat. Then you don't treat them. You ignore them. You go do something else. Job done. You don't participate in the managerial role if that's not your job. Happy to help. It's like if you're working in a bar, and then the boss or the manager says, "Oh, those people are too drunk, can't treat them, can't serve them." It's like, okay, cool. Then we don't. It's like, oh, but it isn't my job to discern whether or not we should serve them. Cool. Well, you've already been told not to, so you don't. Unless it is your job to decide who to serve and who not to serve, you follow the chain of command. Charging migrants for accessing NHS services is a fundamentally racist endeavour. We are complicit in the oppressive... What oppressive regime? How? As in saying, we have amazing healthcare because of the standards, the morals, the foundation, the guiding principles of our society. And by keeping that to ourselves is okay. Okay, so cultural appropriation is fine then, because that's sharing the benefits that one society has made, one culture has made with other people. So then to appropriate is to appreciate, as Stephen Crowder says. Cool, I agree. So cultural appropriation is bullshit. But why is it wrong to make somebody pay for something they didn't buy? Like, what about in a shop? Does that mean if somebody comes over, they don't work in a shop, they're not part of your shop, whatever, and say, I'd like that. I go, okay, cool. And this comes to £42.30. It's like, cool, but I'm not from around here, so I want that for free. It's like, oh, you're not from around here, fair enough. You can have it for free then, because that makes sense. It's like, what? What? Doctors who opposed the motion were booed as they spoke against it on Monday, according to the Daily Mail. The BMA will begin lobbying the Department of Health to overhaul the rules. And from the Daily Mail, they give an example that they give anecdotal evidence as an example of a broader term to try and make it more understandable to most people. It says, the patient sitting in my consulting room at the Royal Marsden Hospital in London was clearly a fraud and quite unashamed about it. He didn't live in Britain, he said with a smile. He had flown to this country solely for free treatment on the NHS. There was no doubt he needed surgery. Urgent surgery. He had a colossal cancer. A sarcoma that weighed nearly 30 pounds was sitting behind his intestines, but his prognosis was remarkably good. With swift surgery, he might make a full recovery. You might assume he was from a poor third world country, but you would be wrong. He had left the UK 20 years before, after completing his education. He had never paid a penny in tax here. So I'm all for private insurance, because then you can take them wherever you go. It's up to you and up to your insurer of how you wish for that to be done. And the National Health Service is it's national insurance. So then you pay in if you're part of the system. But if you're not part of the system, then you don't get the benefits. He said he knew this, but the operation was expensive where he lived. It involved 10 days in hospital, including 2 intensive care, with costs in 6 figures at least. So it made financial sense to take a flight over instead of paying for it. This person says they challenged their managers, telling them that what they considered to be a blatant health choice had confessed to deliberately defrauding the NHS and British taxpayers. Not at all to their surprise, he was informed that he had no choice but to treat the man. predicted that as soon as surgery was done, we would never see him again, and he would fail to attend our outpatients clinics for follow-up care. Of course, I was right. They say that health tourism is believed to cost between 200 million and £2 billion per year. It is hard to know precisely because keeping track of these cases is extremely difficult. And of course, when it comes to suggesting that a brown person has done something wrong, it's racist. So if a brown person is included in these, then you're not allowed to investigate. Doesn't matter how many white girls get raped because of it, does it? No. The patient I described is perfect proof of this scandal and of how the NHS and British taxpayers are being cynically taken for a ride. He was a self-confessed freeloader, and our health authorities should have sent him a bill for the cost of his treatment. The argument against the NHS becoming an international free-for-all is simply about economics. But the BMA, British Medical Association delegates, who accuse critics of health tourism or racism, are using a powerful weapon intended to shut down the discussion without debate. And that is the idea of using words with a particular stink about them. To use the decades-old quote, to say that somebody is racist, or they're a Nazi, or white supremacist, any of these words which have a stink about them, to then associate the person being labelled as such with such stink. And even this person brings up the saying that it's not racist, because how can that be true when so many migrants are white, British-born, and cynically playing the system for all that it's worth? Our system is one that's already simple to manipulate. It is easy to book a GP appointment. Once you have a GP number, you're in, and it's nearly impossible to weed out the imposters, even if they confess. Not every hospital has an overseas visitor manager to pursue patients from abroad for payment, and those that do are often lax. So easy to avoid paying that attempts to prevent these frauds are effectively a waste of time. If we're saying that the waiting lists, and I'm going off script here, if we're saying that the waiting lists are so long and it's difficult for people to get treatment, and we all have an issue because you can have two of the three. You can have it cheap, you can have it quick, you can have it competent. We have it cheap and competent, so it isn't quick, which is fine, unless you have an illness that is getting worse, and something that was treatable becomes untreatable. Something that might be fine and malignant becomes critical, and then terminal during the time that you are waiting, in which case it matters a great deal how much time you have been waiting. And if you have any number of people who are trying to jump the system and take advantage of the medical profession, then these people are clearly a burden on the system and getting in the way of the people who have been paying in and would surely more likely deserve it, or at the very least be the people who are the primary recipients of such, if we believe in a social safety net for our citizens, and say that even if you haven't paid in, we still think that you have value as a human life, and therefore the NHS, the National Health Service, should take care of you, no matter your economic background, then that's fine. But still, saying people like these, who are coming in and jumping the system, still goes against that. Indeed, health chiefs continually complain that they don't have enough resources to combat long waiting lists and delays for investigations and treatment. Surely the priority should be to treat patients who are entitled to care on the NHS, and to ensure that people from overseas pay their way. We can't have it both ways. We say that the NHS is understaffed and underfunded. So surely if there are people coming over who aren't helping with their staffing or the funding, then they should pay their way. That way at least they are paying for the services they receive, as is to be expected in any other aspect of human life. And of course, if we stop charging foreign patients for NHS care, it will only encourage even more health tourism. There is an idea that you tax a behaviour you don't like in order to make it less common. You have a higher tax on nicotine, tobacco, to say, well, hey, this isn't healthy, this isn't good. And then we're going to increase the taxes so that you're less likely to do it. There are obviously ways around it, and if you have people, you have friends on the continent, if you're British, then maybe Romanian, for example, then they can get your tobacco for you a lot cheaper. Or maybe even just in Jersey or Guernsey or one of the Channel Islands, then you can still get it quite a bit cheaper, in which case the tax doesn't matter and you're not getting any of that. It's kind of example of loopholes or capital flight. As illegal as it may be, on an individual basis, it isn't worth prosecuting for, because it's far too expensive, you don't make your money worth. On a grand scale, it is. If there's one person responsible for it, then fair enough, it would be worthwhile. But when it's dissipated throughout the population, it isn't worth chasing out. And I mean, the same argument then goes for taxing the uber rich, as they say. Well, if you're taxing wealth, then surely you're destroying the incentive to be wealthy in the first place. The same goes for death tax, that a large incentive for people to become wealthy is to make an easier life for their children. So if you're saying that you can't do that, then they don't have as much incentive to create the wealth. They say, but to claim it is racist to suggest these patients should pay their way is insulting, manipulative, and deeply illogical nonsense. They say they first wrote in the Mail about this issue 6 years ago. The problem is not patients who have accidents or suffer from unforeseen illnesses while visiting the UK. It is those looking for specialist and expensive treatment who travel to the UK to receive it without having to pay for it. Unless they pay, the care is paid for by you and me, the UK taxpayers. And they have the claps. As it stands, this is the biggest loophole for health tourists. Many new, ordinarily resident patients were recent arrivals from other EU countries. Similar requests for treatment will not stop as long as the UK remains in the EU, so this isn't racist if the other people are white. The only glimmer of hope is that NHS England and the Department of Health will ignore the cabal of BMA left-wingers. And to close at all costs, we cannot allow this to happen. And that makes a lot of sense. It is economic, and not only just economic, because you might say, well, we're understaffed and underfunded, and therefore we don't have enough to go around. Therefore it's economic because, hey, these people are taking the money that could be going to other people because they're taking the resources. But more than that, it's that the fact that they're jumping the queue and even taking money out of it. If you only have so many resources to go around, if it's being given to people who don't deserve it, they haven't bought into the system, they haven't invested, and they just want to reap the rewards, the benefits and the proceeds, then that's more than an economical argument. It is a moral argument, and what these people are doing are deeply unethical. But as usual, do let me know if you think I'm wrong. Let me know if you think it is racist to let these people from all walks of life and from any race, including the white race, to participate in this and to take advantage of it, if it is still somehow racist. Or if it is unfair to have something and not give it to somebody for free, even if you charge other people for it. Let me know if it's unfair to discriminate against particular people, to give them unearned privileges. Let me know if you think that is fair. And I'm brought back to the quote to say that, before you criticise somebody for the speck in their eye, get rid of the log in your own, and get your own house in order. You cannot start to think that you can do well in the world if you cannot take care of yourself, your own home, your own country. You must take care of those around you first. If you fail to do so, what makes you think that you're at all capable of helping other people? And if you cannot deal with yourself, you cannot help yourself, then what makes you think you're capable of helping even those around you, let alone people from far afield? So let me know what you guys think. I look forward to it, and I will see you next time. Have a good evening.